welcome back, everybody. It's time once again to meet our community, the Hispanic business community here in Orange County, powered by the Orange County Hispanic Chamber of Commerce and Orange County's only community radio station, with the only time we've seen him in here before. It's Mitch. Welcome, Mitch. How are you?
I'm doing good, Paul. Thanks very much.
We have tried to get you in as a host, but I know that we got some great ones ahead of you here. Johnny and Reuben and everybody else here, but you've got a background in radio, so
I do.
Come as a natural for you.
I do. Thank you very much, Paul, and welcome to everybody to Our Community is Your Community. My name is Mitch Siegel, and I'm a former board member for 13 years of the Orange County Hispanic Chamber, and halfway through my 24th year as a member. So Johnny and Reuben couldn't make it today, and I'm glad to sit in and invite our guest, Dr. Joseph Shega from VITAS, and we're really appreciative of you being here. Let me give a little background of Dr. Shega. Shega, his background is as an executive vice president currently and chief medical officer of VITAS Healthcare, the nation's leading provider of end-of-life care. Also board certified in geriatric and hospice and palliative care medicine. He has dedicated more than 25 years to caring for, researching, and teaching about seriously ill older adults. So we really appreciate you being here, Dr. Shega.
Thank you, Mitch. Thanks for that introduction. You made my mom happy.
Is she listening or watching?
Always.
Always. That's good. Good to hear. You've, as I've mentioned, you spent the majority of your career with patients with serious illnesses. What led you to hospice and palliative medicine, and why are you so passionate about it?
Yeah, so like you had mentioned, I started my career at University of Chicago as a geriatrician and spent about 15 years taking care of older adults on the south side of Chicago. And the thing that I loved most was being with patients and families near the end of life and really being able to help shape what that looks like. And to me, there's no greater gift than spending time when patients and families are the most vulnerable to help them make informed decisions about care that they do or do not want. And to me, that's just an amazing responsibility. We all get to choose our journey, and the best way to choose your journey is through knowledge and being able to help patients and families understand and make those choices. Like I said, is a tremendous opportunity and gift, and that's what led me down that path to transition from geriatrics to more hospice and palliative care.
So a lot of people think that hospice is just the last few days of your life. What's the biggest misconception of hospice, and what would you like to see change?
Yeah, I always say hospice isn't really about dying, it's about living, right? Hospice doesn't change how long somebody lives. There's no difference in somebody's life expectancy whether or not they enroll in hospice. That's what studies show. But what they also show is that how you live and where you spend your time can make a difference. So people enrolled in hospice are more likely to be at home, surrounded by their loved ones, not in the hospital, not in the ER. They have better quality of life, better pain and symptom control. It really does make a difference. And then family members whose loved ones die in hospice, they're at significantly less risk of depression, anxiety, and complicated and prolonged grief. So it really can make such a profound impact.
We appreciate your company becoming one of our newest corporate partners. It's so exciting. And as family is central to the Hispanic culture. So how does hospice support not only the patient, but the entire family during this time? And personally, I've been through it. My in-laws a year ago actually both passed and went through hospice at the same time. They died within 10 days of each other and were both in hospice for about 3 months prior to that. And then I lost my dad about 3 years ago. He didn't go into hospice. He was at a care facility, but still going through that is tough. And the family supports it, but what's happening in the Hispanic culture as it relates to that, and how do you support that?
Yeah, it's a great question, right? Because one of the unique things about hospice is it's the patient and the family are really the core of the care. And so we focus not only on the patient, but also the family and the interaction between the patient and family, defining sort of what matters most. We recognize, and what the literature shows is that as your loved one with serious illness continues to progress, as a caregiver, you spend more and more time doing direct care. Right? You may spend 40, 50 hours a week providing direct care to your loved one, and that direct care changes over time and it starts to be more and more medical, right? And so you may spend more time taking care of and using a feeding tube or helping to dress wounds or other things. And so with hospice, we're able to really do a lot more of that so that families can really focus on being the wife, the daughter, the son, the grandchild. And You still have to do some direct care. We don't provide 24/7, 365 support, but we're available 24/7, 365 and provide a lot of additional resources so that you can go back to being a family member.
So how can that burden be eased by working with hospice? You're adding more and more hours. I experienced it. We were spending overnight with my mom, and eventually we had to move her and my dad to the assisted living location, and now she's in memory care. But up to that point, it was getting really hard.
Yeah, so I think, just as you said, being able to provide that additional support can really help relieve that burden. And then so much of the medical model is the physical piece of it and the medical piece of it, and hospice is unique because it does have the social, the psychological, and the spiritual as well, with our chaplains, our social workers, working with community faith-based organizations to really help patients and families along that journey, and really recognizing when people with serious illness enter end of life, it's so much more than just the medical condition and the physical stuff. All that other stuff really ties in, and that can really turn into a burden. With hospice, we're able to address those things and work through them.
About 6 years ago, I was approached by the Orange County chapter of the Alzheimer's Association because they wanted to point out to us that Hispanics are 1.5 to 1 against the market to contract Alzheimer's. And they became members and have been great members ever since. We've had them participate in our events. One of their staff members are on our healthcare and wellness committee. And it's just been great, actually, through 2 different CEOs that I've got to know. What should families know in the Hispanic society about navigating a dementia diagnosis and planning for the future as it relates to what you offer?
Yeah, so you make a great point, Mitch, about just recognizing that many of the risk factors that contribute to the development of dementia are more common in the Hispanic population, like high blood pressure and diabetes. And over the 20, 30, 40 years that somebody has those conditions can start to impact function of the brain and the neurons in the brain that predispose them to conditions like Alzheimer's disease or memory loss and dementia due to stroke. And so that can really impact somebody's well-being. And average life expectancy from diagnosis is around 4 to 6 years. And so early on in the course of the illness, identifying what people would want from their care when they can still make those decisions is really paramount, right? And so we spend a lot of time focusing on how to identify what's important when I can't speak for myself anymore. Then I think the other thing is spending a lot of time working with patients and families, particularly families at that point, to recognize, what does end of life look like? Since my loved one's been suffering from this condition for so long, it's hard to recognize when that transition point is to say, on average, this person's life expectancy is 6 months or less. So thinking and talking about how much help they need with their activities of daily living, like bathing, dressing, feeding, transferring, continence, ambulation, some of the things that happen like pneumonias, urinary tract infections, difficulty eating, weight loss. So recognizing when those things occur, that somebody is really now starting to enter the last 6 months of life and starting to engage them in hospice services to provide all that extra support. And as you'd indicated, the Alzheimer's Association is a great advocate for hospice because there's so much data, particularly in hospice in persons with dementia, showing the benefits.
So you just said that there's different signs for recognizing that there needs to be a change in care and going to professionals for medical reasons. If a family doesn't know what you're talking about as far as, and they haven't heard this podcast or other done, how can they find out about that, or where would they go to put themselves in front of that information so they would know to contact companies like yours?
Yeah, VITAS has a website, vitas.com, and on that website, we go over a lot of the identifiers of when somebody is hospice, what we say eligible, meaning that on average, 50% of people like that would pass in the next 6 months. That's the Medicare guidelines. Alzheimer's Association also has some stuff about end of life on their website and are big advocates for hospice. So those are 2 really good resources that people can use to try to figure out where their loved one is on their journey. And there's a lot of resources also around how to consider advanced care planning and start that advanced care planning process.
Wow. I looked through some research and noticed that you guys are also tied to ALS and that organization, and you have a big retreat coming up. So Maybe you could tell us a little bit about that, what was the inspiration behind putting that together? Were you guys involved from the very beginning? It's the third annual. And why is it so important to support caregivers also as well as the patients?
Yeah, so that event is going to be Saturday, July 18th from 9:30 to 1:30. The best place to look for that information, I'll give you the website. It's the ALS United Orange County's website at alsuoc.org/events. And we've been talking a lot about caregivers and the role of caregivers, and we know when patients are diagnosed with ALS, they have significant functional decline, also good mentation usually till the end of life. And so caregivers often have a lot of complex needs, feel overwhelmed, isolated, exhausted, and just need some TLC. And so while we initially focused on the ALS caregiver community, we've now opened that up to caregivers taking care of patients with serious illness. So whether your loved one may be suffering from cancer or dementia or heart failure, you can come to this event if you're a caregiver to get that extra TLC. We'll be doing things like reflective journaling, hand massage, arts, music, other things to just take a step back, take a breath, reinvigorate, re-engage, and just recognizing and sharing some of the challenges that caregiving can have, right? We all want to be able to be there for our loved ones, but that doesn't mean we don't have to sometimes take a step back and reflect and take care of ourselves. And this event is really to help caregivers take care of themselves and take that step back.
Is this retreat only for family member caregivers, or could it be caregivers that work for agencies that work with seniors as well?
Yeah, I think anybody who identifies themselves as a caregiver and is taking care of somebody with serious illness is more than welcome to come.
Why would somebody not want to go?
That's a good question. I think as a caregiver, we're all different and we all adjust differently. Me, myself, I processed my grief from losing my dad and my brother and being a caregiver when I was helping care for them through exercise. So that wouldn't be something that resonated with me, but for lots of people it does resonate. So I think it's just how we all cope differently. We all seek refuge, solace, and building up of our reserves in different ways. And so for those that it resonates with, it's a great opportunity.
So you've cared for families and patients for more than 2 decades. What has this work taught you about life, family, and what matters most? Has it changed your thinking as you approach the customers, the patients?
Michelle, that's a great question. As you pointed out, I'm aging myself, and it does. And when you lose loved ones, I've lost both my in-laws, my dad, and my brother, and doing this work made that a lot easier because I could identify and have the hard conversation. Sometimes healthcare professionals struggle with having the conversation, so it's emboldened me to have those conversations more timely with my family. But it has really put me in a place where I try to let things go. I don't try to let things fester, and I also think I do a much better job of being reflective. And I used to not be one of those people that would take my time off or go on vacation with my family because I was so driven to try to be the best. And now I let that go and I make sure I take my time with my family and take the time to enjoy what I love.
So it's made it more meaningful for you that you've actually lived through it during your professional experience, that you've been able to apply what your knowledge is to your relatives. If you didn't have that, like, where would you turn to? I know we could call your company, but what other resources would lead people to your company that in between people, maybe the Alzheimer's Association, but are there other resources that people can go to?
Yeah, that's a great question, right? So before people reach the end of life when they have serious illness, but they're not in their last 6 months of life, many organizations, whether it's the American Heart Association, the Alzheimer's Association, they have a lot of resources for patients and caregivers. Again, the great thing about hospice is if your loved one dies with hospice services, it's mandated that you get a year's worth of bereavement services. And those bereavement services are tailored to the individuals, right? For me, I was able to get a memory bear where it has my dad's and my brother's clothes on it. And I put it there next to my bed to reflect. And I didn't need other sort of bereavement services, but some people like to do the annual memorial. Some people like group sessions to talk about loss, and whether you're a veteran community, LGBTQ, or any other community, where you can tailor the bereavement to those individual communities. And then some people need more intensive services. And so we work with community resources to set up if somebody might need a therapist or other medical management if they're really having a difficult time with bereavement.
Oh, very good. So for every family that's listening today, if they remembered one thing about hospice care, what would you want that message to be?
I would hope people would take away from this that hospice is a service that can really make a difference, can help you focus on what's important, and help you achieve the goals that you want to achieve before you pass. All of us are going to die, and sometimes it happens and we don't or are not able to do the things that we want to do with the people that we love. And so hospice really does, whether it's days, weeks, or months, allows you to spend that time, to make those memories, to build that legacy that you can always carry it with you.
Is your company aligned with insurance companies, that if somebody has a parent that is on their way out, but it's getting close to that hospice time, that the insurance company could then contact your company to come in and make the changes, the medical changes and so forth, and have them in the comfort of their home?
Yes, that's a great question. How is hospice covered, right? And fortunately, most of the people in the United States who pass are older adults, and so most of them have Medicare. And so whether you have traditional Medicare or a Medicare Advantage plan, they all cover hospice at 100%. So there's really no copays or other bills that families get. In fact, one study showed that when patients transition to hospice that first month that they're in hospice, they save about $640, just because hospice covers the equipment, the medications, the supplies, all related to the terminal illness, the thing that's causing them to pass. And so families often save some money because hospice covers all those things. But we take all insurances, but for Medicare Advantage, which is a preponderance, about 90%, it's covered 100%.
Good. With my in-laws, so they were about 3 months apart at the beginning. She had cancer, and we thought she was going to go first, but he was 100 years old, almost 101. So he kind of sped up in the last little bit, and they both end up having to have oxygen and so forth in separate rooms. My wife actually helped move my father-in-law, who was probably only about 90 pounds. He was always a small person, but three of them lifted him from one. They had to put him on a certain bed, like on the bedclothes, onto the other bed, and then put together the end-of-life bed, hooked up to the oxygen, and then move him back. And a little bit of a funny story, even though they're past here, but my mother-in-law was in the family room, like, what's going on back there? And we were trying to keep everything as light as possible for them. They had been married over 65 years. It was tough to begin with, but everything worked out, and eventually he passed, and then she was right behind him, and 10 days later we were back at the same cemetery putting her to rest. Interesting, but they lived long, long lives, as my parents did as well, and my mother's still around. So my mother was diagnosed at 80, and she's 94. So you said 4 to 6 years is the average of dementia. So that's unusual. I take it that she was definitely diagnosed by a doctor at 80.
Yeah, and so there are many different types of dementia, right? There's Alzheimer's, there's dementia related to vascular disease and other causes. On average, it's 4 to 6. My mother-in-law, she lived much longer. Like your mom, she probably lived 14 years. So definitely, your mom's an outlier on that trajectory, which is great. And it is interesting, the story about your in-laws. One of the hardest things for my mom when my dad was dying was the hospital bed. And I couldn't understand. She just would not put him in the hospital bed. And I'm like, Mom, I don't understand this. He can't move around anymore. We need to be able to position him. She said, you don't understand. I've slept in the same bed with this man for 60 years. And I can't imagine not rolling over and him being there. She's like, this is the hardest thing about this whole thing, is not being able to sleep with him. And it's just, and what's interesting is it's things you don't even recognize, where the supportive hospice can really make a help, because then the social worker and chaplain were able to talk to her and help her make that transition. And she felt so good about it afterwards, because all of that effort it was taking to keep him in the bed was really draining her. But it is interesting, right, that some of the small things that we take for granted can be so profound.
As we get older, we have friends and family that go into the hospital and so forth over time, especially when they're older, for various things. My father, when he was alive and for several years, never wanted to go visit anybody at the hospital because of that. And just understanding, and ironically ended up dying at the hospital. When he was fortunate, he'd only been in a hospital maybe 2 or 3 times in his whole life, and he lived till 94. I understand what you're talking about. We have those thoughts and so forth, and you don't want to tie to it, but it's life in essence, or end of life. I'd like to go back. We have a few more minutes to talk a little bit about the retreat. So maybe you could go into more detail as to like what happens at the retreat. Is it a full day, half day? Are there breakout sessions? What goes on at the retreat?
Yeah, so I said it's July 18th from 9:30 to 1:30. There'll be a breakfast and a lunch, and then they'll have different groups and be able to go to the different groups. Like I said, we'll focus some on reflective journaling, and then people will be able to work with the music therapist, and then people will be able to do some arts and crafts and memorial reflection. And there also will be some virtual reality. You can go on some unique trips through virtual reality. So they'll just be able to spend some time. As I said, we'll also do some hand massages, but they'll be able to do things that interest them and sort of stop focusing so much on the person that they love and focus just a little bit on them.
We've had a couple times on this show, one of our other partners, it's called AI Wellness. I don't know if you're familiar with them, but they obviously go down the AI path. How has AI affected your company, or how do you use it to enhance what you do?
Yeah, so we have a lot of effort focusing on AI. Right now, it really hasn't impacted our care, because the interesting thing about hospice is so much of it is touch, right? Being present. And we can use it to try to optimize scheduling, optimize routes, to minimize drive time so we can spend more time with patients and families. We haven't yet integrated it all. Some health systems have used it to integrate into documentation and stuff. We haven't done that. We are trying to use it better to optimize like dictation services for physicians, so again, they can spend more time at the bedside. And then certainly trying to better identify hospice eligible patients. So we work with a lot of health plans and have created some tools to try to better identify when might somebody be better to have a conversation with. So we've been using AI that way as well.
Great. Are there any other things that are kind of down the pipeline that are going to happen with regards to a hospice that you see bettering the situation or bettering what you offer and so forth?
Yeah, so I really appreciate the fact that CMS and Congress are continuing to look at ways to optimize the hospice benefit. We know patients with end-stage chronic kidney disease who are on dialysis and patients who have hematologic malignancies that need a lot of blood transfusions and platelet transfusions, they are very unlikely to receive hospice services. And so CMS has been looking at a plan with Congress to think about, is there a way to maybe redefine the benefits so that maybe patients with end-stage renal disease or patients with hematologic malignancies can get some of those treatments that are palliative, help improve symptoms while on hospice so that they can actually get the tremendous benefits that hospice offers. So that's one big thing that Congress and CMS is looking at, and we've been trying to work with them on.
For our listener and viewers, use CMS is?
Oh, Medicare.
Okay.
It's the easy way to put it.
Yeah. There's a lot of acronyms in all different industries.
Yeah.
Just want to make sure everybody knows what that is. Anything else that you would like to share about your company or about what you're doing right now? You're out here for the retreat, or this is in advance of the retreat, obviously. You're going back and then coming back again?
Yeah, I find it extremely important to be in the programs, right? I do live in Orlando, and obviously in Florida is where we grew up as a company. Over half the patients we care for are in Florida. And so obviously a large portion of those patients are Hispanic in Miami-Dade, Broward, Orlando, right? Very diverse populations. And I always try to get out to the program, spend time, advocate for hospice services so that we can try to ensure patients get the most out of the benefit. One of the unique things about hospice is it's a defined benefit by Medicare, and it's an entitlement that we hope people can access to improve the quality of their life.
You're here as well, obviously. What other markets is your company present currently?
Yeah, we're in 15 states in the District of Columbia. We cover most of California, Texas, Illinois, Ohio, the Northeast, Georgia, Florida, Wisconsin. So yeah, we're in 15 states in the District of Columbia.
Great. It sounds like some of them are in other Hispanic areas, like you mentioned, Florida, and obviously here, as a chamber, we're connected across the country. One of our board members is on the U.S. Hispanic Chamber of Commerce board, so we can potentially connect you to other organizations if you're not already connected in some of those markets, if you're interested. We just want to thank you very much for being our guest today and taking the time while you're out here on a limited time trip. And it's been great to learn more about what you're doing. And we look forward to having your company be part of our chamber for a long time. And again, appreciate you being here. That's it for our show today. My name again is Mitch Siegel, and you've been listening to Our Community is Your Community.
And before we leave, how do they reach you? What's the website?
To the chamber?
For the chamber, certainly, but for the
retreat, it's alsuoc.org/events.
Okay. And if they want to learn more about the company?
www.vitas.com.
Okay. I want to make sure we get a plug in for everybody here. All right. Thanks for joining us here today on this show as we wrap it up. There you have it. More good reasons to tune in each and every time to meet our community, the Hispanic business community here in Orange County. Powered by Orange County's only community radio station, OCTalkRadio. Streaming live from our studios here at the University of California Irvine's Beale Applied Innovation Center.